No service depends on trust more than healthcare, given how uniquely important and variable and complex and personal healthcare is to their patients. Trust is the bedrock of how clinicians establish relationships with their patients. Trust. Now, we know that a well-understood determinant of patients' trust in a clinician is competence. However, when perceived competence combines with patients' perspectives of their clinicians as a partner, then a higher level of trust develops. I am Leonard Berry. I'm a marketing professor and a health services researcher at Mays Business School, Texas A&M, and I'm a senior fellow at the Institute for Healthcare Improvement, better known as the IHI. I'm co-author of a new article, Trust-Based Partnerships Are Essential and Achievable in Healthcare Service, that is just published now in the Mayo Clinic Proceedings. Other members of the author team are Dr. Karina Dahl Steffensen, who's a medical oncologist at Vala Hospital in Denmark. Sanjay Lecherman, who is a business student, one of my students, and also a pre-med student. And Dr. Rena Oddish, who's here with me today, who will introduce herself.
I'm Rena Oddish. I'm a pulmonary and critical care physician at Henry Ford Hospital in Detroit and the medical director of care experience for the health system. I've also authored a nonfiction memoir based on my own experiences as a critically ill patient called In Shock. And it's really from that intersectional identity that I approach this work.
So how can clinicians establish the highest level of trust with their patients? Their clinical expertise is foundational, of course. We know that. But clinical competence, while essential, is insufficient to become a true partner with patients. It's insufficient to develop a strong trust-based relationship with patients. In our article, we present and discuss 4 interrelated service concepts that are of central importance in taking trust to a higher level, but that have received scant attention in the medical literature. These 4 service concepts are empathetic creativity, discretionary effort, seamless service, and fear mitigation. In the article, we define and give numerous examples of each of these 4 service concepts. And then we finish our article by discussing how health systems can offer support for implementing these 4 concepts. I'm confident that readers of the article will find surprise and they'll find ideas that resonate. Now I want to turn the conversation back to Dr. Oddish to get her perspective on our paper.
I'm thrilled we are discussing trust in medicine and offering concrete ways of understanding how to achieve it in an authentic and collaborative way. Trust is so essential in healthcare, and it's inextricably linked to so many of the outcomes that we all hope to achieve. Whether we consider medication adherence or vaccination rates, or even a culture of safety and high reliability in which patients are empowered to speak up if they notice an issue. All of this has trust at its core. A critical frame shift in healthcare that we're in the midst of is an awareness that we haven't always acted in a way that made us deserving of trust, which means that we have to take a more active role in rebuilding it when we identify a gap. One of the ways we've been doing this in Detroit, which we wrote about in the paper, is partnering with local faith leaders to hold community conversations about the COVID vaccine in local churches and mosques and synagogues. In most instances, building trust requires acts like this, where We level the hierarchy and reach patients through what we've termed empathic creativity.
We present a number of stories and examples in our article, but I'd like to close this video with the story we actually close our article with. It's a story of Stephanie, an 8-year-old girl from Michigan who was headed into surgery for heart transplantation at the Mayo Clinic in Rochester. She asked one of her doctors, Mike Ackerman, if she was going to live. Dr. Ackerman replied, "Of course you're going to live, and I'm going to dance with you at your high school prom." 10 years later, in 2009, with the consent of Stephanie's parents, but unknown to Stephanie, Dr. Ackerman flew to Michigan to surprise Stephanie at her prom. This story of a prom promise kept captures the beauty of healthcare at its best, a force for true healing for patients and for the clinicians who care for them.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.